Hey guys, I'm Evan Hart. I'm one of the physical therapists here at Physical Therapy and Balance Center. Today I will be talking about neck pain. More specifically, I'll be talking about the causes of neck pain, the four most common types of neck pain, and then the treatment plan for those types of neck pain. I want to encourage you guys just to ask questions as we go. If anything needs to be clarified, didn't quite make sense, I'll be looking at the comments on the side and answering them as we go. So let's get into it. First, I'm just going to throw out a question to you guys. I would just like to know how many of you have suffered from a neck pain or headache in the last 30 days. And I'll be looking at the comments there. Uh, Neck pain is really, really common. I'd say here at our physical therapy clinic, it's about 25% of our patient caseload. That's the patients coming in with neck pain. So I kind of wanted to see how many of viewers today have experienced it or know somebody with it. I'd also like you to try an activity with me, just at home or work, wherever you're watching from. What I'll have you do here is just go through all the movements of the neck with me. So just look down, chin to your chest, look up towards the ceiling, rotate each way, and then bend your ear to your shoulder to the left and right sides. And if you experience any pain, stiffness, anything like that, just go ahead, put down a comment, and I'll be on the lookout, okay? A little more about me. So, like I said, I'm Evan Hart. I graduated from LSU in 2016 for my undergrad, and then I completed my physical therapy schooling at LSU Health and Sciences Center here in New Orleans. I specialize in orthopedic and musculoskeletal rehab. I also specialize in balance and dizziness rehab. So I'd like to take that moment to just say, if you have anyone that has, neck pain, back pain, hip pain, knee pain, they're dizzy, they've had falls, anything like that, please send them our way, and we'll help to decrease their pain, improve their function, and improve their quality of life. So now, on to the neck pain. First, I'll be going through several of the anatomical causes or possible causes of neck pain, and I'll be using a little skeleton here just to explain it and make things a little easier to see, visualize. So the first possible anatomical cause of neck pain is your cervical discs. They sit between our spinal segments in our spine. So you can see there's an example of just a disc. I'm sure you can see that okay there. You can think of these as our shock absorbers in our spine. And I'm sure we all know somebody that's had, or says they got the bulging disc, a herniated disc, and that's a very common cause of neck pain. Another common cause of neck pain is issues at your facet joints, and that is where our spinal segments articulate with each other, where they come together. Here, this one's a little hard to see, but you can see it right there. That is an example of a facet joint. It's constantly experiencing stress throughout the day as we're moving our head, whether it's looking up, looking down, we're driving, looking side to side. So when inflamed, this can cause a lot of pain, stiffness, and numbness experienced from the neck. Another possible cause of neck pain is our ligaments, not really shown here on my figure here, but you can think of those as just our natural support wires that help to keep our spine in good alignment. And the last possible cause I'm going to review here is our nerve roots. You can see them here. They're the little yellow pieces coming out the sides. They sit in between our spinal segments and go down our arms. So if you ever have an issue where there's not enough space, there's a nerve root being pinched down upon, something like that, that's whenever you'll have not just pain in the neck, but pain shooting down the arm as well. Good there. Okay. And next, what I'll cover, a few more causes of neck pain. These are the things that are more in our control or because of the environment surrounding us. The first, and this is something I see really commonly in the clinic, is poor posture or postural instability, the medical term. I would say that about 95% or greater of my patients with neck pain present with poor posture, which is typically characterized by forward head, rounded shoulders posture, whether that's due to just living a sedentary lifestyle where you're sitting around and watching TV all day, sitting on the couch, something like that, or if you just work a desk job and you're working in front of you all the time, sitting with that same posture. But that is a really common issue with patients with neck pain. Another common cause of neck pain is neck injury, also known as just whiplash. I'm sure we've all heard of that. Whenever you're in a car crash, car suddenly stops, head whips forward, then back, injuring muscles, joints on both sides. And whenever you have trauma, all bets are off. So you can get a variety of symptoms with whiplash. You can end up with things like neck pain, poor posture, sensitivity to light and sound, fatigue, and then even issues running down the arm. Just because when there is trauma, we're not sure exactly what happens. It happens very fast. Last common cause of neck pain is spondylosis. That's just your regular age-related degeneration of the cervical spine. It happens naturally, and it's not true in all cases, but majority of the time, the issue tends to start with the disc degeneration and then progresses to involve the facet joints, where cervical spinal segments articulate with each other. So now I'm going to get into the common types of neck pain. There are 4 common types I want to discuss today. I'm going to list them and then I'll break them down individually. So if any of them get confusing at any point, just let me know. Make a comment on the side. I'll be looking out. The first type of neck pain we're going to discuss will be neck pain with mobility deficits or stiffness. And we'll discuss neck pain with headaches, neck pain with movement coordination impairments. That's where muscles are not firing in a coordinated fashion. And there's also neck pain with radiating pain, or pain going down the arm. So first, we have our neck pain with mobility deficits, or stiffness. It's commonly diagnosed as cervicalgia, or just thoracic spine pain. Symptoms are usually unilateral, so one side is involved, and you'll have limited range of motion of the neck. That's the main feature. So you just have a lot of stiffness, basically. And onset of symptoms usually occurs with an awkward or sustained position. So when I'm seeing my patients with that fall under this category, it tends to be someone who was looking down at their phone just for a long time, looked up, felt a kink in their neck, someone slept in an awkward position, someone went to a movie theater, movie theaters aren't open now because of COVID, but if you went to a movie theater, you're looking up the screen for a couple hours, you finally relax, leave the theater, and suddenly you just have this pain in your neck that won't go away. When it comes to treating this type of neck pain, we commonly use thoracic and cervical mobilization techniques. So that's where your physical therapist is using manual therapy, getting their hands on you, and mobilizing the spine itself. Other treatments we use will consist of stretching to try and improve flexibility, get rid of that stiffness, and then we reinforce all that stretching with strengthening. The way I explain this to my patients is that if you are doing all your stretches all the time, your neck will get looser and it'll feel better pretty quickly. But if you don't follow that up with strengthening exercises for not just the muscles surrounding the neck, but all your postural stabilizers as well, and then you stop the stretching, it's going to quickly go away and the pain will return. So that's why we do both strengthening and stretching here in the clinic. The next type of neck pain we'll cover is neck pain with headaches. So it's usually characterized by non-continuous unilateral neck pain, and then the headaches are associated with certain movements of the neck. So treatment here is very similar as treatment for our previous type of neck pain, where we're going to work on mobilizing the thoracic and cervical spine, do some stretching, do some strengthening, working on coordination, working on just improving endurance of all our cervical and our postural stabilizers, and we're just working on improving the strength and mobility of the cervical spine and its associated muscles, so that hopefully we can relieve that neck pain and decrease both the intensity and the frequency of those headaches. Let's see. Oh, I got a question. Oh, that's actually for my brother, Stu. I was asking, how should I sit to avoid neck pain? How can I not be awkward? Okay, so what I would like to say to that, what I described before was that forward head, rounded shoulders posture. That's the typical bad posture that you want to avoid. Whenever you are working at home, the tendency throughout the day is to drift into that posture. So I'd recommend is focus on sitting up tall, shoulder blades back, get you some back support and arm support if you can, and focus on retracting your chin. So don't let your head come forward even as you're getting tired throughout the day. Let's see. The next or last type of neck pain that I'll be discussing here is neck pain with radiating pain. The term your doctors might throw at you is radiculopathy. When you hear that, just think there is a nerve root or just the nerve itself being pinched down upon. And when that occurs, you will have symptoms not just in the neck, but symptoms going down the arm as well in the pattern of the nerve. So symptoms here consist of, like I said, neck pain, pain shooting down the arm, and then often my patients will report that their biggest issue is the paresthesias, the numbness, the tingling going down their arm. And when I'm treating them, sometimes there's a little confusion regarding if my arm hurts, why am I treating the neck? And that's when it's important to really educate the patients, that the issue is coming from the neck. So if we deal with the neck, improve the strength, the flexibility of all the structures surrounding the cervical spine, that's when we'll get rid of those symptoms in the arm, and hopefully you'll feel better and be able to do whatever you want to do without being limited by pain. So treatment here is also similar with as our previous treatments, with a few exceptions. Because when you have radiating pain, it's usually due to that nerve root or the nerve being pinched down upon. A treatment technique we commonly use is called mechanical or cervical traction. The idea there is that we're stabilizing here at the chest and applying a force up on the neck here, trying to increase the space between your vertebral segments. So if you have your two vertebral bodies with the nerve roots coming at the sides, just like this, when we're pulling up on the neck, we're trying to increase the space there and decrease the pressure on the nerve. So we can either do that manually by hand, pulling up on the head, or we can use our traction machine, where all it does is hold your head in place and apply a force. It doesn't require much force. Usually we'll set it between 10 and 20 pounds, set them for about 8 to 10 minutes. And then from there, people get off saying, my pain's less, I don't have much numbness in my arm. It's a really easy fix, which we follow up then with some strengthening and stretching to reinforce it. We also do a technique called nerve gliding, and the idea behind that is that we're maximally stretching and then relaxing the nerves going down the arm, gliding them through their fascia, getting that healthy movement, and trying to decrease symptoms. When we're doing this in the clinic, a lot of the times our patients will report, it's really uncomfortable, not sure if that's their favorite exercise, but then at the end of the session, ask them how they feel, and they say a whole lot better. It's because we're getting them moving again, we're getting them used to moving, and trying to decrease the sensitivity of those nerves. So here's something for y'all to think about. If you have neck pain, if you know anyone with neck pain, think about this. Are you in more pain? Are you stiffer in the morning or in the evening? And the reason I ask this is because the answer can help to determine what the real issue is. If you have more pain and stiffness in the morning, it's likely due to a herniated or bulging disc. The way you can think about this is that discs are primarily made of water, and overnight when you're finally resting, sitting still, they tend to bulge. So if you do have a bulging disc pushing down on a nerve, causing symptoms down the arm, and you're waking up in a world of pain, that is likely the anatomical reason why. If you are one of those people, on the other hand, if you have pain in the evening, stiffness in the evening, that's likely due to muscle tightness or weakness. The way to think about this is that throughout the day, as you're working your 8 or 10 hour shift, all the muscles surrounding your neck, all your postural stabilizers are constantly working to hold up your head, hold you in a good posture. So whether you realize it or not, they're constantly working. And if you experience increased pain, stiffness at the end of the day, that's because those muscles do not have the endurance, the strength, they're not in the right position throughout the day. So that's something we would treat in the clinic by working on improving the endurance of those muscles. And it kind of, the trend here is evening pain, likely due to stiff, weak muscles. And so the biggest mistake I've seen or experienced since working here, people with neck pain, they tend to ignore their pain. People just live with it. They make excuses. There's a lot of ways to ignore your pain. There's actually 3 I'm going to cover here, and I'll kind of break them down. The first way to do it is that you just make excuses for it. You say, I'm busy. I got work. I got the kids at home. I got a lot to do. I don't have time to treat this pain. Another way that you can ignore pain is by altering it. That's by taking medications, taking injections, things like that. And one thing that I think a lot of people fail to understand is that while medications and injections have their place, they will get your pain levels down. They're often just masking the symptoms. So while you get that injection, say you feel really good for 3 months, you wait another couple months, the pain comes back. And that's because it didn't solve the root of the issue. The issue's still there, and it's going to come back unless you treat it another manner, aka physical therapy. The last way people ignore pain is by changing it, and this is by having unnecessary surgical procedures. In my professional opinion, I think you should always consider physical therapy first as the first line of defense, because I'll say 80% of the time, or even more than that, we can deal with the pain and deal with the issues, the stiffness, all that here in the clinic without ever having to step into a surgical room, and that can save you a lot of time, money, and additional pain. Because what people tend to forget is that while the surgery will fix the root of the problem, they have to cut through a lot of healthy structures in order to get there. Say the issue is replacing a disc. What are they going to have to do? They have to cut through the skin, cut through the muscles, maybe do some damage to the ligaments surrounding the spine, and that's going to be a lot of healing to occur. So that it's not going to be surgery pain-free. You're going to come out of surgery, it's going to be a world of pain, and we're going to have to do some therapy anyway. And it may not have fixed the problem. It may have been an issue you could have handled here in the clinic in the first place without ever even going there. So I'd say always consider PT first or other conservative means. And so how do we treat neck pain here? I've covered a lot of the possible techniques. I've kind of reviewed some of the things that we do here, but we actually use a European style of therapy. I did not know we did that until it was explained to me when I was making this presentation. But what we do is we use a hands-on physical therapy approach where we're trying to free up the joints and the muscles in the neck to try to regain pain-free range of motion. We also work on strengthening the muscles around the neck. I already emphasized how important posture is in dealing with neck pain, so we focus on good postural alignment. We'll occasionally also use cervical traction, like I previously described, getting pressure off nerve roots, and passive modalities, such as heat, e-stim, dry needling. That's another service we offer. And one thing I wanted to show you guys here that we've actually had really good results with a lot of the patients with neck pain. We actually use a massage gun. It's called a Hypervolt. And the idea behind this is it's exactly what it sounds like. It's going to give you a massage. You focus on what I tend to focus on is hitting people's upper traps, their cervical paraspinals, their thoracic paraspinals, just decreasing muscle tone. If there's any trigger points, getting rid of those, and just it feels really nice, and you can really decrease pain and feel a lot better by the end of each session with use of the Theragun. It also comes with a lot of attachments that we use. So if you need something softer, less aggressive, say you're really pain sensitive, they have like a flatter, nice softer attachment here that's more delicate, versus if you have a lot of trigger points and you're someone who likes a deep tissue massage, something like that, the bullet attachment, which is more pinpoint and will really get into those muscles and deal with the issue. So those are several of the ways that we treat neck pain here at Physical. And just to kind of sum up everything I've talked about today, there are a lot of different treatment programs for the types of neck pain. Doing the right one to address your pain will result in permanent relief, feeling better, and moving overall. So it is a permanent fix. Doing the wrong one, however, frequently makes the symptoms worse. So an effective care plan for neck pain and headache typically consists of facet joint mobilization. That's that manual technique where we're trying to improve the mobility of the cervical and thoracic spinal segments. And this is a skill that physical therapists possess, so that is why I recommend that you see a physical therapist to deal with your neck pain in the most efficient manner. I also want to take this opportunity to say we are offering free screens here at Physical. They're 30-minute consultation with a physical therapist where they'll assess you real quick, tell you what the issues are, how you could benefit from therapy, and they set you up with physical therapy very quickly so that we can deal with your pain and get you feeling better. So I'd really recommend if you have pain, if you know someone with pain, please refer them to us. You don't need a doctor's script. You can call ahead and just set it up. And we will evaluate you and hopefully get you back in the clinic feeling better as soon as possible. And I got another question here from Christina. It says, how do you do physical therapy for a herniated disc? I've only known people that jump straight to surgery. It seems like the back neck problems still persist. So whenever we are evaluating somebody who's saying, I have a cervical disc, what we do is first look at the impairments. We look at the range of motion of the neck. We see where the flexibility deficits are. We see what type of motions are provocative versus which ones help. A lot of times when it comes to treating somebody with a cervical disc issue, I know it sounds kind of obscure to how we're not going to fix the disc, right? But what we can do is do a lot of techniques to improve the mobility of the joints surrounding the disc, improve the strength, stability, and flexibility of all the muscles surrounding it, get them in a good posture, reinforce that posture with our strengthening, so making sure that they maintain good positions that keep pressure off their disc throughout the day. And then we just educate patients on how important it is to stick with all those exercises and those treatment techniques that we used. Additionally, we'll use like that traction, like I talked about, some soft tissue techniques. That's the therapist getting their hand on you, just trying to free up everything in the neck and then reinforce it with strengthening. So I hope that helps to answer your question there, Christina. And if there's any other questions, please feel free to make comments on the side or on this post, and I will answer them, or just call us here at the clinic. That's 504-861-4693. We'll be glad to take your questions, and if you do know anyone, like I said, with neck pain, any other type of pain, dizziness, imbalance, they've had falls, anything like that, send them our way, and we will get them better. So that's it for today. Thank you for tuning in. Thank you for the questions, guys. I appreciate that. And if y'all have any more, like I said, put them down. And I hope that y'all have a great week. Thanks for tuning in.
Wait.
Don't end. Oh.
End.
Do end?
Yes.
Oh, you scared me.